Welcome back to the Lymphoma and Related Diseases Registry, LADA. Today we have Professor Stephen Opad as our guest. So Stephen, can you tell us about yourself?
I'm a haematologist. I'm based in Monash Medical Centre at Melbourne. I've got a particular interest in lymphoma and chronic lymphocytic leukemia.
What's your role with LADA?
I'm the chairman of the steering committee. I was also the founder. I could tell you a little story about how the registry started out. I was in sabbatical in Vancouver in Canada in 2009. I was really impressed by the British Columbia Cancer Agency, which had been collecting data on their patients for decades. And I saw the power of the data, not only to inform them about the roles of various treatment strategies, but it's a way of looking at the quality of care that was being delivered in the state of British Columbia. And so I came back very enthusiastic, saying, we need to do this in Australia. It was after ASH meeting, we put together a one-page proposal to fund registry, and one of our industry partners gave us some seed funding, which enabled us to start this registry with a team from Monash University.
Yeah, so the registry started with 6 pilot sites. Now we have over 30 sites, and in New Zealand as well.
It's incredible. I mean, it's just mind-blowing how quickly the registry and the number of cases and managing all that data is a phenomenal task.
What does the steering committee do?
Originally, the steering committee was set up to try and get broad representation of haematologists from different interests from each state and territory, as well as in New Zealand. The role of the steering committee has always been to oversee the data collection, to look at what research projects we're in, to look at the scientific output. Also, they're involved in putting together the scientific meetings when we present the data. In more recent times, we've looked at how can we broaden the representation on the steering committee. For instance, we've now got a consumer representative. We've got a number of subcommittees, including data verification subgroup, a CLL group, and a pathology subcommittee.
It's a very busy registry. What is your role as a chair of the steering committee? What do you have to do?
As the chair, it does involve having regular meetings with the team from the registry to look at how things are going, iron out day-to-day problems with data collection. Then we have emerging problems such as the change of the lymphoma classification. As the chair of the steering committee, it's really putting together an agenda, making sure that all the voices are heard. The other big part of my role is working with our industry partners to ensure the registry is funded, because it's a very expensive business. There's a lot of people involved. Without the support of our benefactors, we couldn't do what we do.
Exactly, because data collection requires time and resources on the hospital sites as well. I see you provide high-level guidance for us in the registry and also for the steering committee. Then. Going forward, where do you see LADA in a few years?
The registry is fairly young and the median follow-up was short, but we've got over 5,000 cases and the follow-up is becoming longer. So we can get better data output, so we can really get some good information on what are the real-world outcomes. Personally, our site finds it very useful looking at our quality output, so we can use it to measure, to benchmark our hospital against other sites. And it gives us the opportunity to take corrective actions if we find our sites underperforming in any particular disease subtype. I think one of the strengths which we've already been involved is coordination with international groups. This is particularly useful in rare diseases. Some of these diseases are so rare that single sites will have too few patients to answer the clinical questions. So being part of a large team where you can contribute several patients to a study will help us answer some of the questions on the rarer diseases.
Yeah, and the registry data will help to do publications as well?
Absolutely, lots of publications. This is a great opportunity for us to train the next generation of haematologists in a scientific method, as well as data collection and drafting of manuscripts. We hope to, in the future, perhaps even have some registry-based trials. Maybe looking at patient-reported outcomes would be a good area to start off with.
That sounds really great. Thank you so much for your time, Stephen.
Oh, thank you for the opportunity to talk about the registry. Thank you.
Thank you.
Thanks.
Thank you. We'll see you next time.